from the station that's on your side. This is Channel 7 News Daybreak.
All right, 6:24 is the time. High blood pressure is now redefined for the first time in 14 years. So joining us this morning to explain what this means for you, Baptist Health cardiologist Dr. Anthony Fletcher. And Dr. Fletcher, thanks for being here. I know this is something that's, made national news. This is pivotal. American Heart Association saying that now 30 more million Americans are going to be classified in that not just pre-hypertensive, but high blood pressure category.
That is correct. And good morning. This is breaking news. The National American Heart Association meeting is currently going on in Anaheim, California, and this was released on Monday, giving us new guidelines for hypertensive definition and therapy. And this came about after a long review by scholars and academic people who reviewed the literature, reviewed clinical trials, and they sat down and all this information was peer-reviewed, and they released these guidelines yesterday. And what this means is that we now further define who is hypertensive and who is not hypertensive. And the new guidelines actually took away that pre-hypertensive range. And we'll kind of go through those numbers here briefly. Blood pressure less than 120 systolic and less than 80 diastolic is still normal. So that's obviously where we want to be. The 120 to 129 and the diastolic less than 80 currently or before was pre-hypertension, and now it's elevated blood pressure.
Okay.
Know what I say? Elevated blood pressure.
Elevated, yeah.
130 to 139, or the diastolics of 80 to 89, was pre-hypertension before. Now it's stage 1 hypertension. So you have hypertension with those numbers.
Okay.
The numbers 140 to 159, systolic 90 to 99. The old situation that was stage 1 hypertension, now that's stage 2 hypertension.
Okay.
And then finally, greater than 160 on the systolic and greater than 100 on the diastolic is stage 2 hypertension for both categories.
Wow.
Now what this does is this increases the number of individuals who formerly now have hypertension. The prevalence in the old definition was 31.9%, and now it's going to be 45.5% of the population has hypertension. The number of people that would correlate to would be 72 million with the old categories and 103 million with the new categories. But the important thing is that they looked at the people who were pre-hypertensive, for example, and studied them. We had more older people now getting into the clinical trials, and they found that these individuals were having more death and more complications from hypertension with that pre-hypertensive category.
Okay.
So they looked at that 130 over 80 number and said this is where even the older people need to be with their blood pressure. The ultimate goal here is prevention. We've talked many times about stroke, and we've talked about heart failure and renal failure and heart attacks. Treating hypertensives more aggressively and earlier will help decrease those numbers. And they're doing a lot of emphasis now on prevention. Again, we've talked about exercise.
Yeah.
We've talked about low sodium diets. And actually, they decreased the amount of daily sodium.
Okay.
Now it's 1,500 milligrams of salt a day.
So even less than before,
even
folks.
Less
Remember
than before.
that. Yeah, put the salt shaker
Absolutely.
away. Okay.
Exercise is key. Weight reduction is key. And if you're a person who likes to indulge in the social libations, 1 to 2 drinks for males and 1 drink per day for women.
Okay.
Again, the most important thing now is prevention. So if we can get these numbers under the new guidelines, the data tells us we'll live longer, and most importantly, we'll live better. So I think that's the key. And so we really want to look at these. The physicians and healthcare providers will certainly be more aggressive, hopefully, with these guidelines, with getting you to goal, because getting the appropriate therapy and titrating those medications, will certainly help us achieve these goals. So these are just tremendous numbers and information that will help us live longer and hopefully better.
All right, Dr. Fletcher, thank you so much for coming in this morning, explaining what all this means for everybody, because there's a lot of numbers to go through, and sometimes an explanation is best from a cardiologist like Dr. Fletcher. All right, Baptist-Health.com and the Baptist Health Helpline are on your screen.